guys, good afternoon. This is Professor Henderson and welcome back to my YouTube channel. Thank you for tuning in. So today I created a few slides on the Certified Nursing Assistant. So here are the takeaways that you're going to get from today's video. You are going to be getting a few questions on the Certified Nursing Assistant exam. And these questions are going to help you to deepen your understanding and prepare you to pass the Prometric exam. So I create content twice a week. So if you are new to this channel, please consider subscribing because I come out every week with new content on nursing education. Videos on home attendant, videos on certified nursing assistant, videos on RN exams also. So please consider subscribing and please share this video and drop your comments below. So let's dive into the video. I have about few questions, about 10 questions. So let's look at the first question. So the first question is, how is MRSA most often spread? So MRSA stands for methicillin-resistant Staphylococcus aureus. So how is it spread? A, by direct contact. B, by avoiding contact with wounds. C, by practicing good hand hygiene. D, through the air. So right away we can choose the answer A. MRSA is spread by direct contact, by touching contaminated objects or inanimate objects without using proper PPE, personal protective equipment. So we know it not through the air because TB, tuberculosis, is spread through the air, not MRSA. So the correct answer is A, as in alpha. Let's look at another question. Question 2. What is the best way to control the spread of MRSA? So again, A, medication. B, proper hand hygiene. C, mask. D, vancomycin. So according to the Center of Disease Control and Prevention and the World Health Organization, the best way to minimize the spread of methicillin-resistant Staphylococcus aureus is by proper hand hygiene. Washing your hands with soap and water 15 to 20 seconds. So question 3. The best method to control the spread of C. difficile include A, using more nasogastric tubes. B, using various types of antibiotics. C, giving more enemas to cleanse the GI. D, proper hand washing and handling of contaminated waste. So D is the correct answer. So what is difficile? C. difficile. So it's C. diff actually. And when someone has C. diff, they have massive diarrhea and they become very dehydrated. And if someone has C. diff on the unit, it's very easy to pick it up because the stool is very foul smelling stool. So normally if you work in a nursing home or a hospital environment, you would have actually a PPE kit set up at the door. You're going to have a sign posted at the door to see the nurse before entering the room, and whatever the nurses are using, like blood pressure, cuffs and stethoscope, all of that stuff has to be left in the room. You cannot use it on a patient with C. diff and then go around and use it with every other patient on the unit. That's a way of spreading it. Also, you will be cohorting patients with similar diseases such as C. diff. So patients that have another patient, 2 patients that have C. diff can be cohorted into one room. That way you're minimizing the spread of the disease. You don't want a pandemic on the unit. So D is the correct answer, hand washing. good hand washing will minimize the spread because C. diff is caused by spore bacteria. Question 4. Which of the following is not an employer's responsibilities for infection control? A. To take advantage of the hepatitis B vaccination. B. To provide PPE to establish infection control procedure. D. To establish an exposure control procedure. So, which of the following is not an employer's responsibility? So you are the employer. If you're working in a nursing home or a hospital, you're considered the employer. So if you're an employer, it's not your responsibility to provide PPE. So wherever you're working, the hospital, the nursing home, or a home care environment, they are supposed to provide you with personal protective equipment. So B is the correct answer for this question. Let's look at another question. Question 5. Which of the following is not a high-risk behavior for HIV/AIDS? Sharing needles. B. Having unprotected sex. C. Having many sexual partners. D. Hugging people with the disease. So sharing needles, that's a way of contracting HIV. We know that. Having unprotected sex without a condom, that's another way that you can contract HIV. Having several sexual partners, that's another way. Hugging people with the disease, you cannot contract HIV by hugging. HIV is contracted by direct sharing needles, sexual intercourse, anything to do with body fluids. So D is the correct answer for this question. So let's look at another question. Question 6. Which of the following are ways to protect against the spread of HIV? Staying in a monogamous relationship, sharing needles, having unprotected sex, not following standard precautions. So the best way is staying in a monogamous relationship. Monogamous means staying with one partner, not going around and sleeping with several people. That the way increases if you sleep around with many people. So staying in a relationship with one person, you're minimizing the way from contracting any type of STD, sexual transmitted disease. So A is the correct answer. So this question states, which of the following is true about HIV testing? A. It does not require consent. B. The results can be shared with anyone. C. The results are confidential and cannot be shared. A person can be fired if he or she has HIV. So, of course, the results are confidential and cannot be shared. You cannot spread the information to everybody. So it will be a HIPAA violation if you tell everybody, oh, this person come in and they tested for HIV. No, you have to discuss the results with the patient. So C is the correct answer. So guys, I just have these few questions today. So again, thank you again for looking at this short video. I hope these questions can help you to pass the Certified Nursing Assistant test. And if you're interested in getting more material and more study questions and guides on CNA or home health aid or nursing content, please subscribe to my YouTube channel, like and share this video, and drop your comments below. Thank you so much, and I'll see you in the next video. Bye for now.